Hi, good afternoon. I am contestant 8454. Today I will be the nurse and I will be assessing and observing the changes made in the patient's neurostatus. Now with that being said, let's go check on our patient.
Before we see our patient, we must wash our hands. Wash your hands for 20 seconds with warm water and soap.
Hi ma'am, I'm going to be your nurse for today. How are you feeling? Okay ma'am, can you repeat after me? It is quite a rainy day today. Can you try that? Okay ma'am, I'm going to proceed with an evaluation for a possible stroke. I will be using a neurological exam that is used to measure the patient's levels of consciousness, language, visual field loss, motor strength, ataxia, meaning poor muscle control, and dysarthria, meaning poor muscle in the speech. This test is also known as the NIH stroke scale. This assessment is a series of questions that you ask the patient and see how they perform. For this evaluation, I am going to start off with the first category, which is level of consciousness. I will be asking questions toward the patient, and I will be keeping a score on this chart. Now, ma'am, I'm going to ask you a series of questions, and I want you to answer with the best of your ability. This category shows whether or not the patient is alert. So we are going to start off with the first question. Okay, ma'am, can you tell me what the date is today? Okay. Can you tell me the month that we are in? Okay, great, thank you. Okay, ma'am, for the second question of this category, what is your age? Thank you. For the third performance, I'm going to have you open and close your eyes and try to open and close your fist. Can you try that for me? Can you open and close your eyes for me? Great, thank you. Now, can you hold out your fist and squeeze it? Okay, thank you. For the second portion of this test, we are going to be performing the best gaze, which means the patient will be following my finger from left to right and the center. This will determine any abnormalities or any delay within their reaction. Okay, ma'am, I'm going to have you follow my finger from left to right in the center. We're going to begin now. If you could follow my finger to the left, to the center, to the right, back to the center. For the third portion of this test, we are going to be testing the motor skills within the patient's face. Ma'am, can you try to smile for me, please? Okay. Can you try to raise at least one eyebrow for me? Okay. Can you squeeze your eyes shut? Okay. Thank you. For the third portion of this test, we are going to be testing the motor skills within the patient's face. Ma'am, can you try to smile for me, please? Okay. Can you try to raise at least one eyebrow for me? Okay. Can you squeeze your eyes shut? Okay. Thank you. Let's learn some signs and symptoms. We will be talking about the signs of a stroke. Here's a quick acronym that you can learn. It's called B FAST. B meaning balance, E meaning eyes, F meaning face, A meaning arms, S meaning speech, and T meaning time. Now, with the B for balance, meaning you will be checking if the person has unstable balance or not. E for meaning eyes, you'll be checking if the person has lost any visual of the field. Now, F meaning face, you will see whether or not if their face is drooped on one side or if their smile goes crooked. Now, A meaning arms, you'll see, place your patient's arms above and put their palms up, and you'll see if they can hold it up for 10 seconds. Now, S meaning speech, you will see if their speech is slurred. T meaning time, Be sure if you see any of these signs occur, be sure to check the time and call 911. Now, with the signs being said, let's talk about the symptoms. There are 6 main common symptoms for a stroke. The first one is confusion. The second one is trouble with speech. The third one happens to be face drooping. The fourth one is impaired balance. The fifth one is blurred vision. And the sixth one is poor muscle control. That could be in your face, your arms, your legs, wherever. For the fifth portion of this test, we are going to be testing the patient's motor skills within their arms, both left and right. This will determine any abnormalities or delay. So, with that being said, we're going to begin. Ma'am, can you please try to lift your arms and hold them up for 10 seconds? And can you have your palms facing up? Perfect. Now we're going to count. 1, 2, 3, 4, 5, 6. Thank you. Now, the second part of the fifth portion is to test the motor skills in the patient's legs, both left and right. We're going to place them up and we're going to see if the patient is able to hold them. Okay, ma'am, I'm going to start with this test. I'm going to hold up each of your legs and see if you can hold them up for 10 seconds. I'm going to start with your left leg now. I'm going to pick it up and hold it and let you try to pick it up yourself. Are you ready? Okay. 1, 2, thank you. I'm going to do your right leg now. Okay, are you ready? 1, 2, 3. Thank you. For the next portion of this test, we are going to test the limb motor skills. So first we're going to start off with the patient trying to touch their nose and then try to touch my finger. For the second part, we're going to try to have the patient go from their heel to their shin. Now let's begin. Okay, ma'am, I'm going to have you try to touch your finger to your nose with your right arm. Can you do that for me, please? Okay. Can you try with your other arm, your left arm? Thank you. Can you try to touch my finger? Okay, thank you. We're going to try to move your legs. So we are going to try to get your heel to your shin, if that's possible. So basically, so this is your heel, and then this is your shin. If you could try that to touch your heel to your shin for me, please, with your right leg, please. Okay, thank you. Now, can you do the same thing with your left leg? Okay, thank you. For this section of the test, I'm going to be testing the patient's sensory. I'm going to be touching parts of the patient's face, arm, trunk, and legs. With that being said, let's begin. Okay, ma'am. I'm going to be touching your face, your arms, your stomach area, and your legs to see if you feel anything, okay? Just blink if you can, and don't blink if you can't. I'm going to start with your forehead, okay? Can you feel that? Can you feel that? Okay. Can you feel this? I'm going to start with your right arm. Can you feel that? Left arm. Can you feel that? I'm going to move on to your legs. Can you feel that? Left leg. Okay, I'm going to do your stomach area. Can you feel that? Can you feel this area? Okay. Can you feel this? Can you feel that? Can you feel this one? What about your left? Okay, thank you for your cooperation, ma'am. For this portion, I will be determining the patient's language. Therefore, I will be having the patient name an item, describe an item, and have her read a sentence. Okay, ma'am, I'm going to have you try to name this certain item. It says right on here. Can you name that for me? Okay, thank you. Now we're going to try this. Can you describe what this is and what it's on? Okay, thank you. Now, can you try to repeat after me? I went to the shoe shop. Can you repeat that? I went to a shoe shop. Thank you. For this portion of the test, we are going to be testing the patient's language. We're going to see if the speech is still slurred or not. I have 4 words for her to try to read, and we will see how she performs. Now, ma'am, I'm going to point to words, and I'm going to see whether or not you could read and actually pronounce them. Are you ready? Okay, first word. Butterfly. Okay, thank you. Second word. Wait. Thank you. Third word. Diet. Okay. Thank you for that. For the very last portion of the test is extinction. We are going to have the patient close her eyes, and I'm going to touch her face, her arms, her legs, and the very bottom of her legs to determine whether or not she could feel. Now, ma'am, if you could please close your eyes for me. Okay. I'm going to touch one side of your face or both at the same time, and you will try to tell me whether or not you can feel it. Okay, I'm going to start now. This side? No. Okay, I'm going to go with your arm now. Okay, I'm going to move on to your legs. About this leg. This leg. This leg. Okay, thank you. Perfect. After the observations are made, we can now call the physician. Now, with that being said, we are going to call our patient's physician. Yes, hello? Is this Dr. Taylor? Okay, great. I'm here regarding your patient, Miss Diaz. She has scored a 15 on the stroke scale, which is pretty severe. Yes, doctor. I will have those tests ordered. Thank you. Have a nice day. Some tests that might be ordered due to the stroke would be a CT scan, an MRI, and an echocardiogram. A CT scan will show the bleeding within the brain. An MRI uses sound waves and radio waves to determine any brain tissue that has been damaged. Now, an echocardiogram will be needed because sometimes the heart will produce a blood clot that might have gotten up to the brain. Now let's discuss the 2 different types of strokes. There is ischemic stroke and hemorrhagic stroke. The ischemic stroke happens when a blood clot travels to the brain and it damages the brain tissue. Now, a hemorrhagic stroke happens when a blood vessel bursts and there is abnormal bleeding within the brain. Hi, I hope you enjoyed this video, and again, this is contestant 8454. I want to thank you for taking your time to watch this video. Have a nice day.